So, hello all, good evening, and welcome to the series of free Materia Medica session today. That is, we are going to discuss about the remedy Rhus toxicodendron with deeper patterns of its understanding with Materia Medica and repertory. So, welcome you all to today's this session. So, first of all, Rhus tox is a family. Rhus tox is the remedy belonging to the Anacardiaceae family. So before understanding any remedy, the pattern of understanding a remedy very closely is to understand the family pattern or the old school physicians or the toxicology source of each remedy, how they have been used it, and in the toxicology source, how it has produced the symptoms. So first, before understanding Rhus tox, we'll understand the family pattern of Anacardiaceae and its main sphere of action. So botanically, so this is a plant remedy actually. So botanically, this family produces violent affections by the slightest contact and even at times being close to the growing plant without even touching it. So these tell you the sensitivity pattern of Rhus tox or the Anacardiaceae family. At the same time, these lines speaks you out how important a remedy in skin affections. Such is the virulence of this remedy that the symptoms not only last for days together but also reoccur periodically after a single episode of contact with them. So Rhus tox or Anacardiaceae family members are sort of deep acting remedies. So another peculiarity in the presence of these plant kingdom were very milky fluid in the bark which turns black on exposure to sunlight and staining to linen or skin. So therefore they are useful for dyeing agents. This accept shows its ability to have a deep, long-lasting mark on the constitutions, that is homeopathically, often causing damage or disfiguring. So almost all this Anacardiaceae family is very poisonous plant or this Rhus tox, and these symptoms produces, especially skin symptoms, are very prominently marked in this remedy. So some remedies under this Anacardiaceae family I have mentioned. Today we are going to discuss about the remedy Rhus toxicodendron, the poisonous oak. So the toxicity of this remedy. In 1798, Dufersens Valencens the first used it as a medicine. It is brought to his notice by a cure of a young man at a herpetic eruption of 6 years duration through his being accidentally poisoned with the plant. So he has been using this remedy in herpetic eruption, which is of 6 years duration. And interestingly, he has noted that it is used successfully in eruptic diseases, paralysis, rheumatism, as well as eye symptoms. So this toxicity gives you a sphere of action of Rhus toxicodendron remedy. Its main action is on skin symptoms, paralysis, rheumatism, and eye pathology. And I will tell you, Rhus toxicodendron is one of the beautiful remedy in eye symptoms. It's an excellent remedy for eye symptoms until and unless it is indicated. And here you see, a peculiarity of a plant is that it is more poisonous during night. So that's why almost all the Rhus toxicodendron symptoms are aggravated at night. So this toxicity gives you a gist of understanding Rhus tox. So from where we can get this toxicity or this toxicology sources of each remedy. So try to read Clerk's Materia Medica characteristics. Whenever you go through to want to understand the toxicology sources of each remedy, Clerk's Materia Medica is your book to read it. So the toxicology in relationship with physical action. Milford relates instantaneous of Rhus tox poison out of 10 men employed to a clear piece of land of shrubs, among which the poison vein greatly predominated. Only 4 has escaped. Most of the men soon begin to show signs of being tired. At the end of the 4th day, 6 of them were flat on their back, too sick for anything. So such a remedy of Rhus toxicodendron, now you can understand why this remedy is so useful in overexertion, in strain, in sprains. This is the beauty. This is why Rhus tox is very interesting remedy in overexertion, in physical exertion or at the mental exertion, or more strains in the muscles. Actual contact with the plant is not necessary in order to produce its effect. One sultry day in June, a young lady drove a croquet ball across a lane to a clump of poison ivy that grew beside it. Knowingly her susceptibility, she reached under the plant and drew out the ball without touching a leaf. During that evening of the same day, her face began to itch, burn, and the night is swelled so that eyes were not merely closed. The lashes even disappeared in the swelling. It took nearly 2 weeks for her to recover. So the prominent symptom here is face swelling, edematous swelling with a lot of itching, a lot of burning, and night aggravation. See, here you have understood the gist of Rhus toxicodendron. The sphere of action is important. So now we are going to explore the behavioral patterns of Rhus tox. Before that, we'll understand where we can apply this remedy. First thing, skin affections. Next, in genitalia and ringworms. So here a ringworm, right? I will tell you 2 beautiful remedies for ringworms. If in cases of ringworms where the circle of rings are inserted, if it is inserted, one ring is like this, the next ring is touching the other ring. You can think of the remedy Telerium. 31 dose will help it. And if the rings are separated, you can think of the remedy Sepia. And another beautiful remedy in affections of ringworm is basilinum. But in basilinum, you must observe the yellow teeth is more marked for the confirmatory of basilinum and the past history or the present history of any respiratory illness. That is the key confirmatory to prescribe basilinum when you found these ringworm cases. Is it clear? Are you all getting it? My voice is audible. Please do text. Are you all with me? Yes, thank you. So it's an excellent remedy for ringworm in genitals. Until and unless it is indicated, please note it down. Tissue cellular in cellulitis cases, infections, septicemia, carbuncles in early stages. So what could be the remedy when the carbuncles or septicemia infection or abscess, if they go into the later stages? Tell some remedies in the text box so that I can explain you some other remedies as well. What we can prescribe in early stage if Rhus tox is failed. Waiting for your suggestions. Okay, belladonna, pyrogenum, apis, nice. Croton tea, okay, fine. So in cases of Lachesis, right? In cases of this carbuncles, septicemia, boils. So the main remedies we can think of are heparsulf, silicia. If heparsulfis silicia is failed, you can think of the remedy Myristica sebifera. And in boric of first paragraph at last line, he says it is more powerful than heparsulf and silicia. If that is failed, then we can think of Tarantula cubens, which has this action. Tarantula cubens. If tarantula cubens is also failed or not responding, you can think of the remedy anthracinum. And anthracinum is a state of arsenic-like burning, nitramure-like mind, and in chronic carbuncles, septicemia, boils, you can think of the remedy anthracinum. And the other remedies you can think of is streptococcinum. So in this way, we need to think what remedy to be prescribed. So as a homeopath, we are not going to stuck anywhere. We must flow with the remedies. It is a glandular remedy, Rhus tox, swallowing, hot and painful, with a lot of induration and suppuration you can see in this remedy. So this is the beauty of Rhus tox. So generally we think Rhus tox is only for joints and ligaments. It is not. It is beyond that. It is beyond that. And you can see very acrid, rusty, red meat and water-like musty secretions in this remedy. Infectious, irritant, exciting typhoid, rheumatic and paralytic effects you can see in this remedy. Nightly shooting and tearing pains. Night aggravation comes very close to syphilinum. Comes very close to syphilinum in night aggravation. In case of herpes zoster, it is one of the topmost remedy in herpes zoster. Comes very close to ranunculus bulbosa. But in Rhus tox, we need to have to find out that restlessness, that burning, that night aggravation, that itching, loose feeling in the brain, sore, bruised, and stiffness is the main key characteristic of Rhus tox. Now, Rhus tox action. The person who needs Rhus tox has a sensitivity that makes him very irritable. With Rhus tox, it's all about having to move. Anything that causes stagnation within the body, such as cold or cold water or ice, will aggravate. Ice for it is hard, cold quality, and wetness of frozen water is what Rhus tox hates most. So perhaps this is why Rhus tox is easily comfortable by anything that is warm and encourages a flow within the organism, including vigorous massage. This tells you Rhus tox cannot stay in stagnated places, cannot stay in suffocated places, cannot stay in trapped feeling like sensations. They want to outburst, they want to move from that. They like to move. That's why motion amail and warm water amail. And that's why Rhus tox is a one such a remedy aggravated from cold, damp, wet weather. Cold, damp, wet weather. Central idea of Rhus tox. The key, the core is here. The central idea of Rhus tox is stiffness, a lot of stiffness. They become all bonded up and unable to release their inner tightness they feel. Now, this sentence you observe very clearly, the stiffness at the physical level, the stiffness at the mental level is that they feel that their own family is going to attack them. That is the main feeling of Rhus tox. They feel that there are some enemies inside their home itself. They're bonded to that stiffness at the mind level or at the mental level. They want to break free that inner sufferings. That's why there is one rubric like anxiety, sitting, bending. When they sit or bend forward, all the symptoms appears, all the symptoms aggravates. When they started to move, they feel much better. They feel much better. But interestingly, even after moving for 1 or 2 kilometers, again, they feel that exertion. Again, they started aggravation. That is also one thing you need to observe whenever patient tells you. This is seen throughout the Rhus tox symptomology on all the 3 levels, at the mental level, at the emotional level, at the physical level. Rhus tox characteristic is a picture of anxiety, restlessness. They are unable to relax. So Rhus tox constantly need to stretch. They feel the urge to move, to loosen up, to keep from becoming image of ice cold or hard or rocked or stoned. That is the main feeling of Rhus tox. Now we will be understanding very deeper of this mind pattern of Rhus tox. Rhus tox, constantly moving, they become anxious. Understand this beautiful link. You will understand Rhus tox mind in this one paragraph. In this one. See this. Rhus tox constantly moving, they become anxious. The anxiety is from never being able to stay in one place for very long. Change desire can be. So anxiety house in. So progressing into a state where they think something bad is going to happen. So that's why fear of superstitious elements from anticipation or foreboding. So from this feeling of anticipation, from this feeling of fear of superstitious, and from this feeling of anxiousness, they go into the pattern of delusion that something terrible is going to happen. Delusion murdered will be. Delusion someone is persecuting me. Delusion I am suffocated. From there, they develop this anxiety future about. If you catch the one thread that is anxious, want to move, will tell you the clearer picture of Rhus tox. These are the examples of well-known Rhus tox and restlessness on the mental plane. So this restlessness is shown on the thoughts. Mind thoughts rush flow off. Number of thoughts. Then they go into the state of suspiciousness nature. This is the mind of Rhus tox. Is it clear? Is it going well? Are you all understanding it? Are you all getting it? Are you all with me? Is my voice is audible? There is no reply at all. Yes. Thank you. Now see the rubrics pattern. The mind anxiety house in. The remedy is the Rhus tox high grade remedy. Along with that, Lyco and pulsatilla is also there. Another thing, mind fear superstitious single remedy Rhus tox. So whenever if I going to prescribe Rhus tox as a constitution, I will ask these type of superstitious. Actually, I had a beautiful case of herpes zoster where patient said one thing that doctor, due to the skin problems, now, like I did some superstitious, like what I can say you in Telugu, some pujas, like that they have did, but this is not at all going. So that is the superstitious beliefness. That's why they have this fear of superstitious single remedy Rhus tox, single remedy. Mind elements from anticipation. Again, you can see Rhus tox here. Along with that, medorinum. So medorinum Rhus tox comes very close in restlessness. Even zincum also comes very close. But medorinum has that anxiety time is setting. Anticipatory anxiety is more in the medorinum state with restlessness and with a lot of laziness is medo. Here you see, that's what I said. Mind delusion murdered will be murdered he is. Rhus tox again. Hyoscyamus is also there. Stramonium is also there. Belladonna. So all these three remedies, stramonium, hyoscyamus, belladonna is insanity remedies. Trios. The superstitious of Rhus tox. How we can understand this? Any belief having no logical background, no argument, no reasoning is sufficient to rid of him. This idea which is troubling him, example, in the last winter or summer or so and on so months had this problem, now I fear I might suffer again. This tells you delusion injured being can be the superstitious at the same time. Or a cat has crossed the road, someone has sneezed, some unfortunate person crossed the way. had dreamed of some accident or death, etc. So, both the elements of superstition and fear, there is no logical background at all in Rhus tox. That you need to understand. Anxiety level of Rhus tox. Rhus tox experience a constant anxiety as if something terrible is about to happen, something fear of misfortune, and has a fear of evils, fear of injury, even murder, or often feels helpless and forsaken. So why Rhus tox feels this forsaken feeling is because they feel that their inner family members is going to attack. So they seek someone, they don't seek because their own family is attacking. That is the feeling of Rhus tox. That's why they got suffocated. That's why they go into the stiffness, trapped. The anxiety infants indoors, especially at night, and is relieved by walking in the open air, like pulsatilla. Like pulsatilla. The threat seems to come from within the house, leaving him unable to seek help or support. Unlike the remedies that show clinging or desire for company. Even this state, you need to understand the calcarea carb remedy, where they feel that insecurity, but they have the support from the family members. When they get the support or protection from the money or from the relationship or from anything, calcarea carb feel comfortable. They are from the oyster shell. It's a mineral remedy. And that's why carbon element, they show that clinging, desire for company with a lot of fears. So, Rhus tox feels alone, on guard, and silently tormented by inner danger. This is Rhus tox. Some rubrics I have mentioned here. Fear of being murdered, I already discussed. Fear of being poisoned. This feeling comes from the insecurity or attack from their own family. This one rubric will tell you the exact core of understanding Rhus tox. That is, delusion, deserted, she has been forsaken by a near friend. Near friend means near relatives, making him feel forsaken, deserted, not caring. And that gives you the feeling of fear of misfortune. That gives you feeling of they are going to poison me. That gives you the feeling of someone is persecuting me. This is the exact core of understanding Rhus tox. Some mind pattern rubrics, elements from anticipation, thoughts tormenting, thoughts, persistent thoughts, anxiety, abandoned her as if friend had, anxiety alone as if and all about were dead, because he is forsaken. He feel I left alone in this world. I don't have anyone for the company. Fear thinking sad things on, anxiety thought from sad. Here you see mind thoughts rush off, right? There is the remedy Rhus tox again. Some other remedies, valeriana was there, phosphorus, belladonna, coffee, lachesis. Mind suspicious, Rhus tox is there again. High grade remedy. Now coming into the other pattern of understanding Rhus tox. Mind selflessness. The rubric here you can see Rhus tox is there, carcinosin and nitram carb is also there. So what is this main feeling? How we can observe this? When a patient comes and says, I'm feeling sick, doctor, but I'm not worried about myself. I am worried about my kids, my family, my work, my wife, my husband. Anxiety future about, anxiety for children. Even you can see this peer or this thing in causticum as well. Causticum also care, worries for others. Causticum patient also comes and says, doctor, first I don't want to show me. First see my grandfather or granddaughter or grandson. He is suffering with cold and cough. Next I can, no problem. Sympathetic at the causticum level. Single-handed family member is causticum. Rhus tox also have the same sensation. same sympathetic nature. But it is these Rhus tox is only stick to their family members. But causticum, if there is some injustice, they're going to respond. Even though they are near, far, they don't care. Injustice cannot tolerate. But Rhus tox is stick, or I can say limited to some extent. Some extent. Carcinosin is also one such a remedy there. And nitrum carb. And nitrum carb you can prescribe when there is a lot of religious nature. Actually, Farrington has given only two rubrics: insanity, religious nature. Lot of religious, insanity and religious, two remedies: nitrum carb and stramonium. Only two remedies. Coming into the mind state again, they care lot of affection to others and the relatives. Comes very close to the causticum, phosphorus, cocculus. Care, worry is full of, affectionate, anxiety of future, children and family. And Farrington has given one beautiful rubric: anxiety for his own children, single remedy Rhus tox, single remedy. The fragility you can see here, Rhus tox is very fragile in terms of disease and sickness. Rhus tox is very superstitious in nature. Among the anxious remedy, Rhus tox stands out of being one of the top remedy. Fear of disasters, pulsatilla, tuberculinum, zincum and medorinum. And zincum, medorinum, like Rhus tox, all these three are restless remedies, restless. But in zincum, there is a lot of brain fag. And it is one such a remedy in multiple sclerosis. In deeper pathologies, you can think of plumbum actually. And meadow, as I said, a lot of anticipatory anxiety, time is setting, like argentum nitricum and gelsemium. These three remedies comes very close in this anxiety time is setting. And I will tell you medorinum key confirmatory. Always ask for medorinum key confirmatory. Their desires for pani puri, watermelons, cucumbers, green grapes, I can say seasonal fruits, more of seasonal fruits. And most craving remedy in Materia Medica is medorinum. Highly craving remedy is medorinum. And in past history, they are having a lot of UTIs, asthmatic from family history. You can think of medorinum there. And Boger has given one beautiful indication. If you present red moles anywhere in the body, you can prescribe medorinum until and unless it's indicated. And in a recurrent renal calculus, where your well selected remedy failed to act, then they are having this recurrent renal calculus. You can think of the remedy medorinum. Constant anxiety, something will happen. That tells you the fear of misfortune. These make restless. They develop walking, want to be in motion, amel the conditions. This is the central core of Rhus tox. Anxiety sitting bent over. Cannot sit. Full of anxiety if they sit in this position. Single rubrics. Cough delivery after. Anxiety forsaken her as a friend had, as I discussed. And fear of misfortune as well. And must have fresh air. This indicates that patient has to move out from that stiff feeling, from the trapped feeling, from that suffocated feeling. At the mental level, at the emotional level, at the physical level. If you think at the mental level or emotional level, they want to open air. When it comes to the physical level, they want to move on, motion amel. In acute states of Rhus tox, very suspicious and mistrustful. Answers in a hasty manner. Apprehension, suicide as if he wished, and a lot of childish nature you can see in acute state of Rhus tox. And I will tell you here, in acute case of this Rhus tox, joint pains, motion amel is there, and rest aggravation is there. Comes very close to dull camera actually, and both having damp wet weather aggravation. In such cases, you need to observe tongue. Dull camera tongue is whitish. Rhus tox is red tip triangular tongue is Rhus tox. That is where you need to differentiate in acute cases. Some dreams affect unsuccessful. Dreams plans made. Dreams affect unsuccessful reach to a place of. So this tells you the fear of they're going to have something happening. The dreams pattern is most important. Dream world end off. Understand the 4-second feeling. Understand the struggle of Rhus tox, what they are feeling. That's why they have this dream that world is going to end. I said mind thoughts rush off. That's why in dreams also they plan many. Not able to success. Unsuccessful dreams. Because of the, what I can say you, because of the trapped feeling what they are in. The suffocated feeling what they are in. This is what I said. The only remedy you can think after midnight aggravation, like mind dwells on past disagreeable occurrences and patient after 12 o'clock to feel better. To feel better, he calls to someone of his close friend and talks about his past things exactly after 12 o'clock. So midnight aggravation, single remedy, Rhus tox. Single remedy. Now we'll understand the emotional side of Rhus tox. Weeping, tearful mood with causeless without knowing why. Rhus tox, sepia is there, Kalibai, Kalikab, and sugarcane. Right? We already discussed about Kalibai, Kalikab, all the Kali remedies in our paid session. Those who want to have that recordings, you can text me. Weeping, tearful mood, stool before and during, like borax and phosphorus. And I'll tell you one beautiful clinical tip. So whenever you get a case of acne, pimples, and patient says, doctor, I have applied a lot of creams, then after all these pimples have started. Can be borax. Can be borax. And their skin is so sensitive that even they do some work with some instruments, that instrumental things has to be appeared on the skin, that patches or whatever the instrumental things. That is borax. Weeping, tearful mood, evening, morning, and night. Weeping, tearful mood, walking in open air when amelioration. Oh, sorry, it's not borax, sorry, it's Bovista. I'm very sorry, I'm discussing about Bovista. Borax is one such a remedy you can think in a hair growth of remedies, or Pila pylonica, you can think of borax there. Now coming to the core of the remedy. In some few rubrics, we can understand the core again. That's what we discussed. Feeling trapped, feeling suffocated, delusion suffocated. See this rubric. Dreams escape of unable to escape from a place in which he entered before. How beautiful, how beautifully you can interpret the dreams at the level in the mental state. That's why understanding the dream pattern is most useful, not just noting down while case taking. See this rubric. Escape of unable to escape from a place in which he entered before. So they are trapped, they are suffocated. Coming to the situational Materia, this was taken from Soul of Remedies, which was written by Sir Rajan Shankaran. Situation of a woman who has young children and is alone in the house with her violent drunkard husband who is quite capable of killing her. She has to be on her guard. She is vigilant, nervous, tense, and sad, etc. She is brooding, crying, and unable to express her fears. She is dependent upon her husband and worried about her children. All this can make her resort to prayers, and she may become superstitious. She may also be afraid that her husband will die, and this make her even more anxious. How beautifully Sir has described. In this para, you can understand the fear of superstitious, the fear of anxiousness, the care worries for her husband, care worries for their loved ones, the trapped feeling, the suffocated feeling. This is the situational Materia. If you understand the remedy in such a patterns, you're never ever going to forget the remedy. This remedy rightly deserves an important place in the list of our polycrust remedies. It affects the fibrous tissue very powerfully and is adapted to the persons of rheumatic diathesis. We find it is useful whenever tendons, ligaments, aponeuroses, and connective tissues are inflamed, and either due to overexertion or the exposure. These are some tips or some observations you can think to prescribe Rhus tox. So we are entering into the physical sphere or the particular spheres of Rhus tox. See this. I'll go fast wherever it is important. I'll be concentrating because the gist of Rhus tox you have understood. The complaints of this remedy comes on from cold, damp weather, from being exposed to cold, damp air when perspiring. The patient is sensitive to cold air, like herself, and also his complaints. In aconite and bryonia, we find aggravation from exposure to cold, dry air. Understand this. Aconite bryonia is dry air, where Rhus tox, rhododendron, nitrum sulph, pulsatilla, or some other remedies which have this cold, damp, wet weather aggravation. And nitrum sulph is a beautiful remedy and a top grade remedy with this cold, damp weather basement aggravation who work in the cement labor works, buildings. Then they develop these kind of symptoms, especially asthma. You can read Fatak. He has beautifully written. Fatak Materia Medica. In colchicum and dulcamera, the aggravation is noticed from exposure to cold, damp air. Same, like Rhus tox. Hepar, sorinum, and tuberculinum are also characterized by extreme sensitiveness to cold, either damp or dry. So, and all are better from warmth. In general way, the aching pains, the bruised feelings over the body, the restlessness through the limbs, and amelioration from the motion are the features that prevail throughout all conditions of Rhus tox. I will tell you another keynote. See, this is very interesting point you need to understand. So this is where we fails actually. Patient will tell you after some walk I feel better. You prescribe Rhus tox. May fail sometimes. Why? I will tell you. See, while he is better from motion and better from walking, if he continues to walk, he become exhausted. This question you need to put in front of your patient. Any continued exertion of the body or the mind exhausts the Rhus tox patient. It must be remembered that Rhus tox is not only a remedy that has aggravation on the first moment. There are more remedies, that is anacardium from the same family, conium, capsicum, ferrum, lyco, and pulsatilla are few others that have this similar modality. Now we'll understand the cellular tissues of Rhus tox. Rhus tox has a very strong action on the cellular tissues of the human body. We should think of it in cellular infiltration whenever found secondary to inflammation. In Rhus tox, this infiltration is very easily gives ways to pus formation, whereas in EPIs, the cellular infiltration rarely or never terminates in the same way. So, connective tissues, inflammation forms an integral part of Rhus tox, as it is in the aconite and belladonna. But only in Rhus tox, the affected part looks dark and red. The swellings may look shiny in belladonna, shiny appearances in belladonna. But the differentiating features is that the inflamed skin of Rhus tox is covered with numerous small, painful white vesicles. I think I have showed that picture. This is what this differentiates Rhus tox as an old chronic rheumatism remedy. Rhus tox is suitable in old chronic rheumatic conditions. He is stiff, lame, bruised, and first begin to move. The passes off on become warmed up, but soon he becomes weak and must rest. Then comes the restlessness and aching and uneasiness which drive him to move and which again make him better. But soon he becomes weak and this continues. This is the cycle of Rhus toxicodendron in almost all rheumatic conditions or in athletes or in players. So that he is never perfectly at ease and never finds rest. Inflammation of the glands and of the mucous membrane, infiltration of the muscles. Farrington, the great master, writes, Farrington tells that Rhus tox is a great remedy for overexertion. Overexertion, a player of a wind instrument getting pulmonary hemorrhage, Rhus tox will be his remedy. If from violent exertion a patient is seized with paralysis, his trouble may be yield to Rhus tox. Arnica, we generally think of arnica, but arnica has not the strained feeling of Rhus tox. This you need to understand, my dear doctors. The arnica is not such a high grade in the strained feeling like Rhus tox. Hill climbing is arsenic. Rhus tox is almost the specific for strains and sprains. Same master writes again, but of lumbago, he says here Rhus tox is the remedy, whether the patient is better from motion or not. Rhus tox has a great pains in attempting to rise, stiff neck from sitting in draught or intrascapular pains, better from warmth. I will tell you. In cases of backaches, actually, where you don't get any proper modalities, patient tells backache doctor, but it is continuous, there is no amelioration, but continuous pain. Patient is not giving you prominent modalities or perfect modalities. In backache cases, what remedy you can think of? Do text it. Do it fast. What remedy you can think of? Okay, I'll tell you the remedy. When your well-selected remedy fails to act, especially in this lumbago, backache cases, where you have prescribed Rhus tox, agaricus, nux mostata, or whatever you can say, beriberi vulgaris, it's nothing at all working. You can think of the remedy verolinum. Verolinum, low potency, few doses. If you read Fatak, he has written. The master Fatak has written very beautifully with bold letters. And in my clinical practice, I have seen it as working with beautiful results. Verolina 30C water dose, which I prescribe. Coming into the cellulitis, cellulitis of pelvis, of the neck, about the glands with much swelling. So it's a prominent remedy of skin we already discussed. So inflammation of the skin that become erythrolytic purpule, pitting upon the pressure with large blisters with fill with serum, sometimes bloody. It has abscess, carbuncles, and vascular eruptions. Inflammation of glands that are hot and very, very painful. Now, inflammation of glands or inflammation of any wounded part, if you touch it, it is cold and painful. What is the remedy? Here, hot is Rhus tox. If it is cold, what could be the remedy? Waiting for your answers. Are you all with me or you all understanding it? Please do text. Yes, ledum. Ledum. And ledum has this ascending type of pains. In orbital cellulitis, Rhus tox is almost all specific remedy. Coming to the fever patterns, it's a beautiful remedy actually. It has cured many cases of arsenic can be arsenic is not. Arnica can be because in inflammation you need to examine arnica like head is hot and extremities is cold. That is Montana sign of arnica. It has cured many cases of intermediate fever, is often suitable in a remnant fever, and is most useful remedy in continued fevers and is in a low form of typhoid fever. I will tell you, Sir Rajan Shankaran sir, Rhus tox he has kept in typhoid miasm. So that tells you the sphere of action of this remedy. Rhus tox, when acute diseases takes in a typhoid form, it forms dysentery, scarlet fever, diphtheria, and pneumonia. So Rhus tox is indicated in dysentery when there are tearing pains down the thighs during defecation. I once cured a case of smallpox which had degenerated into hemorrhagic type, the pustules consisting of bloody pus with Rhus tox. The indications for the remedy were stools of dark blood with pains tearing down the thighs during stool. In dysentery cases, when you get the symptom, the tearing pains down the thighs, you can think of Rhus tox. Rhus tox in typhoid, mild temperament, delirium, mild, so may try to jump out of the bed to escape. So escape desire for, you can see in this remedy. Restless, cannot lie still. Sometimes the hallucination, fear he will be poisoned, will not take the medicine or food. As a fear, people desire to poison him. Hyacinthus also have this feeling actually, and lacases. So that's why hyacinthus have this fear of being poisoned. You can see there. It's a top remedy in hyacinthus. Tongue dark, brown, red cracked. Cracks may gap and bleed. Triangular red tip tongue, typhoid pneumonia, rusty sputum, almost intolerable back pain with fevers. Rhus tox. In intermediate fevers, it is a very important to note that the point at which the chill starts. This you need to interrogate in fever cases. Rhus tox starts in one leg, usually in the thigh or between the shoulders or over one scapula. The chill starts in the one leg or in the thigh or between the shoulders or over one scapula. But eupatorium, sometimes nitramure, begins in the small of back, the chill at the back. With this intermediate fever, you can think of eupatorium or nitramure. If it runs along the spine, it is gelsemium. Coming to the prominent action of Rhus tox in eye pathology. Inflammation of eyes in rheumatic subjects from exposure to cold, damp weather. Is my voice is audible? I get a notification that my internet connection is not stable. Is it clear? Voice is clear. Please do text. Okay. With a lot of perspiration, with restlessness and fear. So pustules upon the cornea, photophobia you can see, suppurations of the eyes, inflammation of iris of a rheumatic character, iritis with joint pains. In such cases, Rhus tox is a wonderful remedy. If you get a case of recurrent tonsillitis with rheumatic affections, you can think of the remedy guacum and streptococcinum. There is much swelling and the eyes are closed from swelling. Very acute conjunctivitis. Eyes are red and aggravated in the morning. Scrofulous inflammation of eyes from becoming cold. The lid are red and edematous. The swelling, redness, burning, you can see in this remedy. Inflammation of eyes, very sore around the right eye. Great swelling of the lids. Eyes are closed or greatly swollen and inflamed. Left eye closed from swallowing lids. Inflammation of lids, we already discussed. A lot of heaviness and stiffness at the lids, like a paralysis feeling. The patient will say, doctor, stiff, I cannot able to move feeling. So I cannot even move my eyelid. Such painful swelling. Please help me, doctor. Can be Rhus tox. Can be Rhus tox. In ophthalmic cases, it's a top remedy for orbital cellulitis, edema of lids, pustular inflammation, suppurative iritis. Coming into the paralysis of Rhus tox. Rhus tox is useful in various forms of paralysis, especially in rheumatic patients from overexertion or exposure to weight. See, in every set of the symptom, in every set of the system, what I'm going to discuss, this is a prominent. Overexertion, exposure to weight, overexertion, exposure to weight. If you find it in any symptom, any chief complaint, whatever may be, if you find it with restlessness, with anxiety, confirm Rhus tox. Or if you find overexertion, exposure to weight is the causation, and the tongue is a red triangular tip, is Rhus tox. So that's why you need to understand the exciting cause, the fundamental cause, the causative factor in each case. plays a crucial role. He thinks it originates in the rheumatic inflammation of meninges of the cord. The three remedies he contrasts for paralysis from cold are Rhus tox, sulfur, and causticum. Causticum, only one-sided paralysis. Right-sided Bell's palsy is caustic. Can be past history, never well burns, sympathy. Aversion to sweets is a high confirmatory for causticum. Aversion to sweets. Rebellious, injustice. These are some symptoms of causticum. Why I'm telling all this is you need to differentiate when your patient is in front of you. You need to cross question who is the patient in front of you. Coming to the skin pattern, erysipelas with numerous vesicles that burst and secreted for 8 days a slimy liquid after 8 days. And after 24 hours, the itching and burning commence, lasting for a half an hour or 2 hours. After 36 hours, the swelling of the part with violent itching and burning increased on touch. That's what we discussed in the toxicology source of Rhus tox on Anacardiaceae family. Or moving, the parts affected as if pierced from hot needles like arsenic. And white transparent vesicles appeared around the highly red inflamed skin like ranunculus bulbosa. Coming to the next pattern here, covered from head to foot with fine red vesicular rash, itching, burning terribly, especially in the joints, worse at night, causing constant scratching. This restlessness you can see in the scratching as well, with little or no relief, and which felt very hard when pressed with the finger. Skin is burning hot like arsenic. Face become red, swelling, edematous. Hand, skin, whole body become covered with scarlet like exanthema with intolerable itching. Biting on the fourth day, the back of the hand, legs become covered with blisters, lot of blisters, with violent vesicular erysipelas, and with a state of high fever. With a state of high fever is most prominent. I will tell you the differentiation. Urticaria from getting wet during rheumatism with chills and fever worse in cold air. This was line taken from Fatak. How beautifully he has written. He's a master. Urticaria from getting wet during rheumatism with chills means with fever pathology. And fever worse in cold air. But in heparsulf, urticaria is present before and during the stage of chill. In ignitia, during heat only. In epis, urticaria shows itself as soon as the stage of chill is over. During the stage of sweat, Rhus tox patient sleeps profoundly as in podophyllum. One peculiar symptom of Rhus tox that has helped to score for this remedy many success, that is hydroma on the lip. If you find it, blindly prescribe Rhus tox. Eczema, raw with thick crust, oozing and offensive. Burning is there, itching is there, a lot of tingling pains, scratching, greater aggravation for scratching or greater urgency to scratch. Coming to the main key symptom of back. Stiffness in small back, painful on motion, small back feel bruised. I will tell you the interlink of this. See, now how we can understand these psychosomatic analyses or mind, body, soul axis. Back, so right, back is the spine. This is a support to our body, right? So in Rhus tox, I have told you before in mind that in family itself, he has the problem. In family itself, he has some enemies. Now, we all know family is a support to everyone. Everyone. To live a beautiful or a good life, family support is needed. If that support is not there, then this develop the symptoms of backache. Why only back? Because back is the support of the whole body. There the family support is lacking. He feels family is forsaken. That's why Rhus tox develop backache. And another remedy I'll tell you, kali carb. Also have this quarrelsome from bread and butter. else some is in his own family members. And Kalikam is a beautiful remedy for backache. With back sweating, back weakness, and never Welsing's pneumonia. This understanding you need to understand. If a patient comes to you and tells a neck pain can be platina because pride is affected there, can be platina, you need to interlink the physical sphere to the mental, to the emotional. Everything is interlinked. This is the beauty of holistic approach of homeopathy, the classical homeopathy. Are you all understanding? Coming into the limbs terrible after exertion them. The limbs feel stiff, paralyzed during and after walking, with a sensation of 100 weight on the nape of neck. I will tell you one beautiful remedy. Beautiful remedy. If anyone is there here, you can tell the remedy. For example, in cases of this neck pain where you don't get any modalities, patient is feeling lot of stiffness in the neck, cannot able to move right and left. This is so much of bothering me. Please give some remedy. Patient is not able to express the symptoms, but tells neck pain, neck pain, neck pain. What could be the remedy? What could be the remedy? Do it fast. Please, please do it fast. Yes, the remedy is Lacnanthus textura. You can read from Boric. Lacnanthus textura from Boric. He has written. And other remedy I will tell you, Stictapi. Stictapi. Stictapi is one such a remedy for, I can say you, for this rheumatism of neck. But in Stictapi, you need to find the respiratory complaints. And Boric has written in the first characteristic, last line with bold letters, rheumatism of neck. This is the beauty of understanding clinical Materia. This is what I'm going to teach you. A lot of drawing and paralyzed sensation on the left arm in the night. A lot of drawing in all the limbs you can see while lying down. Trembling of arms, often moderate exertion of them. Pain in the left upper arm as if muscles and tendons were unduly strained. The limbs is carried by them far upwards, backwards at 2 and 3 p.m. A loss of power, you can see. This is the exertion. Stiffness in the forearms, fingers on moving them. Completely loss of power, complete stiffness, completely trapped feeling. You can see in this lower limb extremities. Here you see great weakness of legs while walking in open air, afternoon, hardly able to proceed because they are so heavy and very like gelsemium. That's why this remedy also comes very close, that muscles doesn't obey their will. But in gelsemium, the stiffness is absent. And Rhus tox, there is stiffness. Great heaviness in the legs while sitting, disappeared on walking. Aching pains in the legs, unable to rest at any position but for a moment. Unusual restlessness at night. Great restlessness you can see in this. Stiffness on rising from the seat. Turn in every direction on the chair and move all her limbs like pyrogenum. Soreness in every muscle passes off during exercise. You get patients, right? His wife or some uncomes daughter and son, doctor, now my father, he tells night so much of pain, he is not able to sleep, doctor, severe pain, but early morning he will go for swimming or he'll go for some playing badminton. Why, doctor? I will say you need not to go, but my father will go. That is the indication of Rhus tox. That is the indication of Rhus tox. Every sentence of case taking is very important. Coming into ear and nose, it's not much known remedy here, but neuralgia in the ears, same again. Inflammation in the external ear with vesicles, inflammation of parotid gland, hemorrhage from the nose with violent coryza. Nose is stopped up for every cold, like dull camera. Great soreness in the nostrils, discharge from the nose thick yellow mucus like calibi, like pulsatilla. Yellow mucus, greenish offensive mucus you can see. Much swelling on the nose from erysipelas. Tip of the nose is red and sensitive. The nose is puffed up with edematous. Eruptions upon the nose and in the corners of nose. Eczema of the nose and much swelling. Neck I already discussed. We'll go through very fast through this. In Rhus tox, the thirst is often violent, but there is difficulty in swallowing. Solids from constriction of the throat, painful swelling, inflammation of the throat, cellulitis of the throat, internal and external with painful inflammation of the throat. Enlargement of the neck, swelling of the glands of the neck you can see. In parotids, neck is greatly swollen. And Rhus tox has cured diphtheria with these symptoms. Rhus tox is especially suitable for inflammation of esophagus when it is in the acute form of swallowing corrosive substances because of this extensive cellulitis that such a substances cause it may to case like Rhus tox. Freaky remedy of Rhus tox. This remedy is very freaky. For instance, hunger without appetite, hunger sensation or sensation of emptiness in the stomach without a desire for food, dryness of mouth and throat with great thirst, thirst for cold drinks, especially at night with great dryness of mouth, yet the cold drinks brings on chilliness, brings on cough. How beautiful Rhus tox. The contradictory you can see here. Desires and aversions. This plays a very crucial role in selecting the remedy. I always say to my uh, students or my doctors who have joined in my paid sessions or in my classes, I always tell you, never search for any particular remedy until and unless you find 10 particular remedies. If you don't find the general character, that remedy doesn't work. That remedy doesn't work. Desires for beer, cheese, old cheese aggravation. And interestingly, cold milk desire is Rhus tox. Cold milk desire is Rhus tox. It's a prominent symptom of Rhus tox. Desire cold food, cold water, warm food, warm sweets, lyco. That is difference. And milk causes diarrhea, sepia. Hot tea, fumes must come out of the tea, can be chelidonium. Desire for raw food, desire for raw onions, aggravation desire, thuja medorinum. Thuja medorinum. That's why desires and aversion plays a crucial role. Antimonium crudum, if you think of to prescribe, ask the desires for Indian pickles, spicy. Naxomica is more of spicy desires. Coming to the stomach, the same it is written here. Pain in the stomach and nausea. His desires also strong. Desires for oysters, cold milk, sweets, aversion to meat. Rhus tox has nausea and vomiting. Bilious vomiting and nausea from drinking cold water. Nausea from after eating with sudden vomiting. Incoordinate appetite with inclination to vomit. So it's more of a nausea remedy. You can think of especially after eating. Here you see, I'll tell you one prominent symptom somewhere. Yeah, in the stomach and nausea, especially after cold things, pain in the stomach after ice creams, pain in the stomach after ice creams, nausea after eating ice creams. Now, here you can differentiate. Phosphorus is restless. Phosphorus is anxiety. Phosphorus wants for cared loved ones, right? But phosphorus love ice creams, love cold drinks. But Rhus tox, it causes aggravation of symptoms. Ice cream after vomiting. It's a very peculiarity of Rhus tox. In the liver, there is swelling, tenderness on pressure so that he cannot lie on the right lobe of the liver. The soreness is increased on begin to move. Shooting pains in the region of liver. Coming into the heart, uncomplicated hypertrophy from violent exertion. Heart feels tired, pain goes down to left arm. Palpitation worse when sitting still, better by walking. Trembling in heart, better by walking and pulse. Pulse is so quick, weak, and irregular intermediate with numbness of left arm. So left arm numbness, left arm achings with heart diseases. You can think of this remedy. Causations we already discussed: slightest anger, damp sheets, cold, wet headache. Beer causes headache. Bathing in fresh or salt water, strains, overlifting, getting wet when heated, summer bathing. Modalities was wet, cold, cold air, washing with cold water, rest before storms. I will tell you, before storms. And patient loves thunderstorms. He feel thunderstorms, he feel better. Sepia, tuberculin, sorry, carcinosin. I'm sorry. And fear of thunderstorms is prosperous. Understand this. Better by head bath, heating, rubbing, motion, nosebleed, and holding on abdomen. Thank you everyone who has joined to this session. And please, everyone, please share your feedbacks when this video is going to be uploaded in the YouTube tomorrow. Your feedback, please show some love for me in the comment section of YouTube. This video is going to be uploaded there. Please, everyone who has attended my session, please share your feedback there. And you can join these groups of Learn Homeopathy, Instagram and Telegram. We are going to share my experience and my cases as well. If you have any doubts, you can ask me. And please, everyone, don't forget to share your feedback when this video is going to be uploaded in the YouTube. Please show some love. That makes me to understand, to go deeper pattern for you all, to collect the enthusiasm and the interest coming from you all. Thank you all. If you have any doubts, I can, or we can have I can close the session. And if you want anyone to want my paid sessions, which I done on Kali Salt, 15 Kali Salt remedies, we have discussed with 10 Kali Salt remedies, 10 sessions. With 10 sessions, every hourly, one session is around 1 hour 30 minutes. We have discussed almost all 15 to 16 sessions in Kali. And recently we have done deep dive into polycrust remedies, where we have discussed 5 remedies: aconite, aluminum, abrotinum, anacardium, very beautifully. If you want it, you can DM me. If you want it, you can DM me. I will just you can DM me so that I will help you all. Once you scan this, you will get my number there as a group admin. You can text me there. Yes, YouTube channel name is The Homeopathic Center. The Homeopathic Center. I will share that link in the group today, so that you can, if you join the group, we'll be updating all the links there. So please join, and please everyone share your feedback when that video is going to be uploaded in the YouTube. Thank you everyone.